Welcome to my channel Nursing Medici. So I haven't done video for last 1 month. Apologizing all of you because I got delivered and my daughter is 4 weeks old now. That's why I couldn't do any videos last month. So we are continuing with our Aptitude series, and now we are doing Aptitude series 5. So I have done 4 series, and today's station, what I'm telling is, you may get a station with a patient who has diabetic mellitus. So they will give the scenario like the patient is so and so age and they have diabetic mellitus and they have some symptoms. They may tell some of the symptoms and do the assessment and do nursing care. That may be your station. So if you are getting a patient with the diabetic mellitus and some symptoms, so you should recognize, is that the symptoms of hyperglycemia or hypoglycemia? That's what they want you to assess in that station. Okay, are you getting? So you're getting a station with a patient who has diabetic mellitus, and they may tell you some of the symptoms. This patient has sweating or drowsiness, so and so, some of the symptoms they will say, and they will tell you to give nursing care to this patient. So that time the assessors want you to recognize, is that hyperglycemia or hypoglycemia. Most of the time they may tell you to, they may give symptoms of hypoglycemia. So if they are telling you to do the nursing care, you should do the assessment first. You should assess. How you are going to assess? You have to talk with the patient. So before you are doing anything, first of all, you have to introduce yourself to the patient, and you should make a therapeutic relationship. As I'm telling always, you should make the therapeutic relationship with the patient. For that, you have to talk with the patient, and of course, you have to read the scenario properly and your task properly. Then only you will identify, or you will realize what you have to do in that station. Then you should do the assessment. How you are doing the assessment? You are going to talk with the patient. You are asking what are the symptoms you have. So the patient is going to tell, I have these symptoms, and so they may tell you. So that time you are recognizing that may be the symptoms of hypoglycemia. In that case, you have to talk to the patient. You have to reassure to the patient that these are the symptoms of hypoglycemia or low blood sugar level. So that's why you are experiencing this. So I will give you something for that. And what you can give if a patient has hypoglycemia, of course you can give some drink with the sugar. So maybe you can give a glass of milk or biscuit or any juice, whatever is available there you can give. So you can tell like, I will offer you a glass of milk, so that she will be okay. These all are the symptoms of hypoglycemia. Okay, then after that, once you are giving that juice or the milk, you have to take the, if the patient is sitting in the chair, you can tell the patient like, maybe you will be tired, or I will take you to the bed. So you can assist the patient to the bed and make sure the patient is safe. Once you are making sure the patient is safe, you have to check the drug cardex or the drug sheet of that patient, and just ask for a check for the insulin, check for the insulin. And you have to talk to the patient and ask, did you take any insulin today? So maybe patient will say, I didn't take, or patient will say, I have taken. So if the patient is telling that patient has taken the insulin, you have to ask to the patient, did you eat anything after that? So if the patient is telling, I have take food or something like that, that will be fine. If the patient is telling, I haven't eaten anything, but I took the insulin. If the patient's answer is like that, you have to order food for the patient. So you can order the food. So you just tell to the patient, oh, okay, that's why you have hypoglycemia, because you have taken the insulin and you didn't eat anything. I will order some food for you. So that's all you have to do in that station. I hope you understood this station. So you may get station with the patient has hypoglycemia. always I'm telling you have to read the scenario and you should read what is your task. So once you're identifying your task, you should be confident enough to do. Okay, so that's what you have to do. And I hope you all are reading the RCSI website, all the things for the theory test and the practical, and familiarize with all the topics in that site, so you'll be okay for the examination. So that's all for today. I hope you understood this video, and please make sure to share with your friends whoever is writing aptitude exam. And if you are new to this channel, please make sure to subscribe my channel. And if you have any opinion or anything, you can give the comment, or if you need any topics, you can give the comment. And please like this video if you like this video, okay, and press the bell icon so that you will be notified with my new videos. So that's all for today. I will come with another video tomorrow. Bye bye.